Okay, we're gonna do hip rotations, my all-time favorite exercise, part of your pain cocktail if you haven't checked out that series. But here we go. Lie down, make sure that your neck is long, chin is slightly tucked. Your hands are palms up, out to the side on both sides. Slightly, just a hair lower than shoulder height. I don't want them up high where there can be compression to the neck, so just slightly below shoulder height, palms up. Your knees are hip width apart in parallel, and your feet should be even from right to left. I can just assist my head to look and make sure my knees are even in height, and that helps me set my legs up so that they're straight. Okay. Remember, you find the bumps in the front of the pelvis. That's how wide apart your knee should be. It's similar to shoulder width. Okay, palms are up, and you're gonna very carefully, without shimmying your hips, without lifting your buttocks. So I just showed you what not to do. Okay, don't lift your buttocks. Don't let them move. That's the body trying to escape out of the stretch. So you're going to not let your pelvis lift, carefully raise the ankle and place it on top of the opposite knee. And your foot can be just slightly off the leg, particularly your first time. That makes it a bit easier. If we wanted to intensify it, I could pull it back a little bit. But start off just slightly off the leg, and now from here, you're going to lower the foot until it comes flat. Once that foot is flat on the ground, you're going to then take that knee into the power of your muscles of your hip, push the knee away from your chest, away from your face, down that way, and hold that push. So you're using the power of the hips to abduct and externally rotate this hip in an open packed position. The foot must stay flat on the ground, the big toe in particular. Don't let that foot roll. I think you can see it there. That is out of the eccentric exercise. Keep the foot flat. Push the knee as far as you can away and hold it the entire time while maintaining the foot flat. That's so, so important. Keep that foot flat. I'm looking at you because I'm talking to you, but you're going to keep your head and nose and eyes towards the ceiling. Notice this entire time I have my knee away from me, holding that eccentric active exercise to the right hip for 30 seconds to a minute. The bottom leg should be soft. So the bottom leg is relaxed, the top leg is dynamic, pushing away from you only as far as you can, keeping the foot flat down on the ground. Neck is long and soft, and in that stretch, I'm talking, but you should be breathing in deep and breathing out long. Breathe from the base of your spine to the top of your head. Breathe out from the top of your head down, and you're holding that active hip exercise, dynamic contraction, lengthening hip exercise for 30 seconds to a minute. To come back up, you're going to take a deep breath in. On the exhalation, you're going to pull your legs back up, uncross, and reestablish neutral before switching sides. What does that mean? It means when you pull this leg down, you're still rotated. You need to do either a little pelvic tilt or two, or just a slight little lift of the buttocks to reset and get neutral. If that was your tighter side, you've done one to both sides and one side is tighter, remember the key is to do extra reps to the tighter side. That's what's going to realign the lumbar spine and sacrum, right? So if this was my tighter side, I would do it again. So palms up, ankle on the knee. Remember not to lift to get there. Drop down till that foot's flat. Once that foot's flat, soften the bottom leg, the other leg. Just let it release. Push that knee away from you as far as you can. And breathe in deep, breathe out long for 30 seconds to a minute. to come back up. Deep breath in. Exhale. Pull the legs back up. It's a little bit of core work. Uncross and reestablish neutral. Your little lift of the butt, little pelvic tilt before switching to go to the other side. So that is a fast version of hip rotations, the best exercise ever to realign the low back, strengthen the hips, open the hips, release neural tension, release muscle spasms, and really, again, lubricate and realign the lumbar spine, hips, and discs. All right.